Professor Sabay Sabaysan. I'm a medical oncologist and a clinical dean for the Medical Training Network in the James Cook University and the Townsville University Hospital in North Queensland, Australia. We wrote an article recently on values-aligned organizational culture as a foundation for workforce wellness. Is it a pipe dream? So this is about asking questions, how we could improve workforce wellness by improving culture rather than purely working on individuals. Moral injury occurs when someone faces or observes actions or behavior that are in complete contradiction to their deeply held moral values. In healthcare settings, most of the organizational values are related to compassion, respect, engagement. In terms of then personal values, you could argue that they are all the same. But for system point of view, I feel that the organizational values are about how the processes, projects, and activities actually demonstrate these values. Whereas in a personal value, compassion could be simply asking someone, how are you? How was your day? Whereas in a organizational values, the examples could be, for example, compassion is about filling vacancies in a timely manner so that people don't do extra work and they are not fatigued. So that's showing compassion to the workforce. And then if you talk about rural people, you could say providing care closer to home using telehealth is how you show compassion to rural people so they don't need to waste time traveling. So that's one of the examples and why I wanted to make sure that we separate these two entities. So when the organizational values and the operational behaviors, actions are not aligned, it has consequences on patient outcomes and the staff welfare. So we know most of the organizations set out their strategic purpose and plans on strategic plans. And when these values and operational behaviors are not aligned, patients are not going to get the right care at the right time or the best care. And the staff well-being is also going to be affected. So that leads to poor organizational culture, poorer clinical outcomes, the workforce disengagement, and moral injury, and finally burnout. But the important things to remember here is that organization might be able to achieve their number and budget-based KPIs, but they will achieve it at the expense of the culture. In terms of healthcare management, we know that the management teams have multidisciplinary professionals, as we see in the clinical setting on the floor. And we also live in a democratic setting, and we have multiple personalities, multiple people with different abilities. And we know, especially in healthcare settings, we are all incomplete leaders. So we actually need complete teams. So my question is, how can we leave a decision-making in the hands of one or two incomplete leaders without taking into multiple perspectives? So this is where the truly values-aligned organizations will have a team-based decision-making where multiple perspectives are considered by all of them, and the decision-making is consensus. So obviously, more brains you have, with more perspectives you have, the better holistic decision you're going to have. But unfortunately, the current system doesn't allow that, and the aspirational values-aligned culture hopefully can achieve that. In this table, we attempt to explore some of the examples against some of the commonly used values. For example, excellence. So developing and implementing action plans to achieve strategic mission and vision of the organization is important. And if we can tick off all the items on those strategic plans, we are going to be excellence. And then next example is compassion. So providing care closer to home for rural, regional, indigenous patients is a way of showing compassion. Another example is filling vacancies in a timely manner to avoid fatigue for other staff. And setting targets related to health outcomes and patient outcomes rather than just KPIs related to numbers is again showing compassion. An example for respect is responding to emails and queries in a timely manner, and also receiving feedback and input from staff before finalizing plans. In terms of our culture, we have a predominantly a no culture. So if you can adopt a policy that it avoids saying no without evidence of ineffectiveness of someone's idea, will be showing respect. And then lastly, for engagements, rather than sending emails and staff forums, we could actually formalize the engagement through team-based operations or high-functioning teams. And also when we develop solutions and quality improvement initiative, we can involve the workforce in a co-design system or in a partnership models, clinician management and consumer partnership models. So these are the examples. If we can implement them as a process rather than philosophy, we could achieve alignment. Workplace culture and shared purpose are linked to workforce wellness. We know the research shows that in poor cultures, the system delivers poor outcomes, and there is high rate of burnout among the workforce. Usually those organizations are obsessed with achieving numbers and budgets, but not holistic outcomes. In a healthy workplace, employees feel belong, they are empowered, and they are valued and enabled to do things. What you will find in a healthy culture is that the workforce that do things and those things that they do are usually holistic activities that are already described in the strategic plan and the strategic purpose. So in this situation where alignment happens, all the workforce is now aligned to the strategic purpose. They are empowered to progress the strategic plan items, and they are going to see big results, holistic outcomes. And it makes them feel good. It makes them feel valued. And that means they are well. So they are going to come back to work next day wanting to do more. They are going to give you extra or discretionary energy to do more things, to deliver better outcome for their colleagues and for their staff. So I think that's why I believe that the workforce wellness agendas should be focusing and putting a lot of effort into improving cultures rather than just sending people for psychological interventions and mindfulness workshops. In terms of involving staff and making them feel belong to an organization and empowering them, we cannot keep talking about team-based operations, engagement, team building as philosophies. I think they need to be incorporated as structures. So for example, if we make a policy that the healthcare organizations now need to run informal teams, the team leaders actually have to give us who are the teams, what are the teams of responsibilities, how do they make decisions, ideally co-design and consensus-based democratic decisions, and then how do they interact with each other with respect, trust, and all those good things. And then in terms of the team performance, then suddenly you are looking at a holistic performance metrics that's articulated by the strategic purpose. So they are going to be now formally given the responsibility to manage their areas. So that's engagement. But also in terms of making decisions or making plans and projects and ideas, I think the core design approach is fundamental. So if anyone comes with an idea and say, I'm going to implement this, there should be a policy asking who was in your core design. And if they can't answer the question, go back and do your core design. What that means is that the core design or the partnership models will ensure that the people have gone on and got the consumers, workforce, and multiple managers and clinicians involved in that core design to come up with the best decision for everyone and for the patients. So these are a couple of examples, but also obviously policies need to be there for timeliness of vacancies and responding emails and few other simple stuff. But I think we need to focus on some structural reforms.